Gastric cancer. Anatomy and physiology of stomach. The stomach is a J-shaped organ in the upper abdomen. It is part of the digestive system, which processes nutrients, vitamins, minerals, carbohydrates, fats, proteins, and water in foods that are eaten and helps pass waste material out of the body. The wall of the stomach is made up of 5 layers of tissue. From the innermost layer to the outermost layer, the layers of the stomach wall are mucosa, submucosa, muscle, subserosa, connective tissue, and serosa. Gastric cancer begins in the mucosa and spreads through the outer layers as it grows. Definition: stomach cancer is the medical term for the abnormal growth of cancerous cells in the stomach lining. Stomach cancer begins when cancer cells form in the inner lining of the stomach. These cells can grow into a tumor. Also called gastric cancer, the disease usually grows slowly over many years. Stomach cancer, also known as gastric cancer, is a cancer that develops from the lining of the stomach. Types of stomach cancer. Every stomach cancer diagnosis is different, and no treatment is the same. The different stomach cancer types in patients are: adenocarcinomas. Adenocarcinomas build within the cells of the inner lining of the stomach. Most stomach cancers fall into this category. Lymphoma. When cancer cells grow abnormally in lymph tissues located in the stomach, it is referred to as lymphoma, a stomach cancer definition that is tied to the cancer of the immune system. Gastrointestinal stromal tumors. This is a rare type of stomach cancer found in a special cell in the lining of the stomach which develops through digestive tracts. Carcinoid tumors. When cancer begins in cells of the stomach which are responsible for secreting hormones, this leads to the formation of tumors which are known as carcinoid tumors. Risk factors: having any of the following medical conditions: Helicobacter pylori, H. pylori, infection of the stomach; chronic gastritis, inflammation of the stomach; pernicious anemia; intestinal metaplasia, a condition in which the normal stomach lining is replaced with the cells that line the intestines; gastric polyps; Epstein-Barr virus; familial syndromes, including familial adenomatous polyposis; eating a diet high in salted, smoked foods and low in fruits and vegetables; eating foods that have not been prepared or stored properly; being older or male; smoking cigarettes; having a mother, father, sister, or brother who has had stomach cancer. Signs and symptoms. In the early stages of gastric cancer, the following symptoms may occur: indigestion and stomach discomfort; a bloated feeling after eating; stomach discomfort or pain; mild nausea; loss of appetite; heartburn. In more advanced stages of gastric cancer, the following signs and symptoms may occur: blood in the stool; vomiting; hemoptysis; weight loss for no known reason; stomach pain; jaundice, yellowing of eyes and skin; ascites, buildup of fluid in the abdomen; trouble swallowing; routes of cancer metastasis. Cancer can spread through tissue, the lymph system, and the blood. Tissue. The cancer spreads from where it began by growing into nearby areas. Lymph system. The cancer spreads from where it began by getting into the lymph system. The cancer travels through the lymph vessels to other parts of the body. Blood. The cancer spreads from where it began by getting into the blood. The cancer travels through the blood vessels to other parts of the body. Diagnostic evaluation. The following tests and procedures may be used: physical exam and health history, an exam of the body to check general signs of health, including checking for signs of disease, such as lumps or anything else that seems unusual. A history of the patient's health habits and past illnesses and treatments will also be taken. Blood chemistry studies, a procedure in which a blood sample is checked to measure the amounts of certain substances released into the blood by organs and tissues in the body. An unusual, higher or lower than normal, amount of a substance can be a sign of disease. Complete blood count, CBC, a procedure in which a sample of blood is drawn and checked for the following: the number of red blood cells, white blood cells, and platelets, the amount of hemoglobin, the protein that carries oxygen, in the red blood cells, the portion of the sample made up of red blood cells. Upper endoscopy, a thin, lighted tube is inserted through the mouth to look for abnormal areas in the esophagus, stomach, and first part of the small intestine. Barium swallow, a series of X-rays of the esophagus and stomach. The patient drinks a liquid that contains barium, a silver-white metallic compound. The liquid coats the esophagus and stomach, and X-rays are taken. This procedure is also called an upper GI series. CT scan, CAT scan, a procedure that makes a series of detailed pictures of areas inside the body, taken from different angles. The pictures are made by a computer linked to an X-ray machine. A dye may be injected into a vein or swallowed to help the organs or tissues show up more clearly. This procedure is also called computed tomography, computerized tomography, or computerized axial tomography. Biopsy, the removal of cells or tissues so they can be viewed under a microscope to check for signs of cancer. A biopsy of the stomach is usually done during the endoscopy. The sample of tissue may be checked to measure how many HER2 genes there are and how much HER2 protein is being made. If there are more HER2 genes or higher levels of HER2 protein than normal, the cancer is called HER2 positive. HER2 positive gastric cancer may be treated with a monoclonal antibody that targets the HER2 protein. The sample of tissue may also be checked for Helicobacter pylori, H. pylori, infection. The following tests and procedures may be used in the staging process. Endoscopic ultrasound, EUS, a procedure in which an endoscope is inserted into the body, usually through the mouth or rectum. An endoscope is a thin, tube-like instrument with a light and a lens for viewing. A probe at the end of the endoscope is used to bounce high-energy sound waves, ultrasound, of internal tissues or organs and make echoes. The echoes form a picture of body tissues called a sonogram. This procedure is also called endosonography. CT scan, CAT scan, a procedure that makes a series of detailed pictures of areas inside the body, such as the chest, abdomen, or pelvis, taken from different angles. The pictures are made by a computer linked to an X-ray machine. A dye may be injected into a vein or swallowed to help the organs or tissues show up more clearly. This procedure is also called computed tomography, computerized tomography, or computerized axial tomography. PET scan, positron emission tomography scan, a procedure to find malignant tumor cells in the body. A small amount of radioactive glucose, sugar, is injected into a vein. The PET scanner rotates around the body and makes a picture of where glucose is being used in the body. Malignant tumor cells show up brighter in the picture because they are more active and take up more glucose than normal cells do. A PET scan and CT scan may be done at the same time. This is called a PET-CT. MRI, magnetic resonance imaging, with gadolinium, a procedure that uses a magnet, radio waves, and a computer to make a series of detailed pictures of areas inside the body. A substance called gadolinium is injected into a vein. The gadolinium collects around the cancer cells so they show up brighter in the picture. This procedure is also called nuclear magnetic resonance imaging, NMRI. Laparoscopy, a surgical procedure to look at the organs inside the abdomen to check for signs of disease. Small incisions, cuts, are made in the wall of the abdomen and a laparoscope, a thin, lighted tube, is inserted into one of the incisions. Other instruments may be inserted through the same or other incisions to perform procedures such as removing organs or taking tissue samples to be checked under a microscope for signs of cancer. A solution may be washed over the surface of the organs in the abdomen and then removed to collect cells. These cells are also looked at under a microscope to check for signs of cancer. Management. 7 types of standard treatment are used. Surgery. Endoscopic mucosal resection. Chemotherapy. Radiation therapy. Chemoradiation. Targeted therapy. Immunotherapy. Surgery. Surgery is a common treatment of all stages of gastric cancer. The following types of surgery may be used. Subtotal gastrectomy, removal of the part of the stomach that contains cancer, nearby lymph nodes, and parts of other tissues and organs near the tumor. The spleen may be removed. The spleen is an organ that makes lymphocytes, stores red blood cells and lymphocytes, filters the blood, and destroys old blood cells. The spleen is on the left side of the abdomen near the stomach. Total gastrectomy, removal of the entire stomach, nearby lymph nodes, and parts of the esophagus, small intestine, and other tissues near the tumor. The spleen may be removed. The esophagus is connected to the small intestine so the patient can continue to eat and swallow. If the tumor is blocking the stomach but the cancer cannot be completely removed by standard surgery, the following procedures may be used. Endoluminal stent placement, a procedure to insert a stent, a thin, expandable tube, in order to keep a passage, such as arteries or the esophagus, open. For tumors blocking the passage into or out of the stomach, surgery may be done to place a stent from the esophagus to the stomach or from the stomach to the small intestine to allow the patient to eat normally. Endoluminal laser therapy, a procedure in which an endoscope, a thin, lighted tube, with a laser attached is inserted into the body. A laser is an intense beam of light that can be used as a knife. Gastroduodenostomy, surgery to remove the part of the stomach with cancer that is blocking the opening into the small intestine. The stomach is connected to the jejunum, a part of the small intestine, to allow food and medicine to pass from the stomach into the small intestine. Endoscopic mucosal resection. Endoscopic mucosal resection is a procedure that uses an endoscope to remove early-stage cancer and precancerous growths from the lining of the digestive tract without surgery. An endoscope is a thin, tube-like instrument with a light and a lens for viewing. It may also include tools to remove growths from the lining of the digestive tract. Chemotherapy. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. When chemotherapy is taken by mouth or injected into a vein or muscle, the drugs enter the bloodstream and can reach cancer cells throughout the body. Systemic chemotherapy. Radiation therapy. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. External radiation therapy uses a machine outside the body to send radiation toward the area of the body with cancer. Chemoradiation. Chemoradiation therapy combines chemotherapy and radiation therapy to increase the effects of both. Chemoradiation given after surgery, to lower the risk that the cancer will come back, is called adjuvant therapy. Chemoradiation given before surgery, to shrink the tumor, neoadjuvant therapy, is being studied. Targeted therapy. Targeted therapy is a type of treatment that uses drugs or other substances to identify and attack specific cancer cells. Targeted therapies usually cause less harm to normal cells than chemotherapy or radiation therapy do. Monoclonal antibodies and multikinase inhibitors are types of targeted therapy used in the treatment of gastric cancer. Monoclonal antibody therapy. This type of therapy uses antibodies made in the laboratory from a single type of immune system cell. These antibodies can identify substances on cancer cells or normal substances that may help cancer cells grow. The antibodies attach to the substances and kill the cancer cells, block their growth, or keep them from spreading. Monoclonal antibodies are given by infusion. They may be used alone or to carry drugs, toxins, or radioactive material directly to cancer cells. There are different types of monoclonal antibody drugs. Trastuzumab blocks the effect of the growth factor protein HER2, which sends growth signals to gastric cancer cells. Ramucirumab blocks the effect of certain proteins, including vascular endothelial growth factor. This may help keep cancer cells from growing and may kill them. It may also prevent the growth of new blood vessels that tumors need to grow. Trastuzumab and ramucirumab are used in the treatment of stage 4 gastric cancer and gastric cancer that cannot be removed by surgery or has recurred. Multikinase inhibitors. These are small molecule drugs that go through the cell membrane and work inside cancer cells to block multiple protein signals that cancer cells need to grow and divide. Some multikinase inhibitors also have angiogenesis inhibitor effects. Angiogenesis inhibitors stop the growth of new blood vessels that tumors need to grow. There are different types of multikinase inhibitor drugs. Regorafenib is a multikinase inhibitor and angiogenesis inhibitor that blocks the effects of the multiple proteins inside tumor cells. Regorafenib is being studied in the treatment of stage 4 gastric cancer and gastric cancer that cannot be removed by surgery or has recurred. Immunotherapy. Immunotherapy is a treatment that uses the patient's immune system to fight cancer. Substances made by the body or made in a laboratory are used to boost, direct, or restore the body's natural defenses against cancer. This type of cancer treatment is also called biotherapy or biologic therapy. Immune checkpoint inhibitor therapy is a type of immunotherapy. Immune checkpoint inhibitor therapy, PD-1, is a protein on the surface of T cells that helps keep the body's immune responses in check. When PD-1 attaches to another protein called PD-L1 on a cancer cell, it stops the T cell from killing the cancer cell. PD-1 inhibitors attach to PD-L1 and allow the T cells to kill cancer cells. Pembrolizumab is a type of immune checkpoint inhibitor. Stages of gastric cancer. The clinical stages of stomach cancer are: Stage 0. Limited to the inner lining of the stomach. Treatable by endoscopic mucosal resection when found very early, in routine screenings, otherwise by gastrectomy and lymphadenectomy without need for chemotherapy or radiation. Stage I. Penetration to the second or third layers of the stomach, Stage 1A, or to the second layer and nearby lymph nodes, Stage 1B. Stage 1 is treated by surgery, including removal of the omentum. Stage 1B may be treated with chemotherapy, 5-fluorouracil, and radiation therapy. Stage 2. Penetration to the second layer and more distant lymph nodes, or the third layer and only nearby lymph nodes, or all 4 layers but not the lymph nodes. Treated as for Stage I, sometimes with additional neoadjuvant chemotherapy. Stage 3. Penetration to the third layer and more distant lymph nodes, or penetration to the fourth layer and either nearby tissues or nearby or more distant lymph nodes. Treated as for Stage 2, a cure is still possible in some cases. Stage 4. Cancer has spread to nearby tissues and more distant lymph nodes, or has metastasized to other organs. A cure is very rarely possible at this stage. Some other techniques to prolong life or improve symptoms are used, including laser treatment, surgery, and/or stents to keep the digestive tract open, and chemotherapy by drugs such as 5-fluorouracil, cisplatin, epirubicin, etoposide, docetaxel, oxaliplatin, capecitabine or irinotecan. Nursing management. Nursing diagnosis: 1. Pain, acute chronic, related to the presence of abnormal epithelial cells, nerve impulse disorders of the stomach. Goal: pain is reduced, controlled. Expected outcomes: the patient was not seeing grimacing. Pain scale of 0, no pain. The patient seemed more relaxed. Intervention: 1. Assess characteristics of pain and discomfort, location, quality, frequency, duration, etc. Rational: provide a basis for assessing changes in the level of pain and evaluate interventions. 2. Reassure the patient that you know the pain is real and that you will assist the patient in reducing the pain. Rational: fear can increase anxiety and reduce pain tolerance. 3. Collaboration in analgesic administration to improve circulation within the optimal pain prescription. Rational: tend to be more effective when given early in the cycle of pain. 4. Teach the patient new strategies to relieve pain and discomfort with distraction, imagination, relaxation. Rational: improving alternative pain relief strategies appropriately. Nursing diagnosis: 2. Imbalanced nutrition, less than body requirements related to anorexia. Goal: nutritional needs of clients are met. Expected outcomes: the client will maintain nutrient inputs to the metabolic needs. Increased appetite. No weight loss. Intervention. 1. Teach the patient the following things. Avoid the sight, smell, sounds unpleasant in the environment during meal times. Rational. Anorexia can be stimulated or enhanced by noxious stimuli. 2. Suggest eating preferred and well tolerated by the patients. Better food with high content of calories, protein. Respect the patient's food preferences based on ethnicity. Rational. A food that is well tolerated and high in calories and protein will maintain nutritional status during periods of increased metabolic needs. 3. Encourage adequate fluid intake, but limit fluids at mealtime. Rational. Fluid level is necessary to eliminate waste products and prevent dehydration. 4. Increase fluid levels with food can lead to a state of satiety. Consider the cold food, if desired. Rational. Cold foods high in protein can often be well tolerated and does not smell than hot food. 5. Collaborative provision of commercial liquid diet by way of enteral feeding through a tube. Elemental diet. Rational. Feeding through a tube may be necessary in the patient with very weak gastrointestinal system is still functioning. Nursing diagnosis. 3. Anxiety related to malignancy, advanced disease. Goal. Anxiety clients decreased. Expected outcomes. Clients are more relaxed. The normal pulse. No increase in respiration. Intervention. 1. Provide a relaxed environment and non-threatening. Rational. The patient can express fear, problems, and the possibility of anger due to the diagnosis and prognosis. 2. Encourage active participation of the patient and family in care and treatment decisions. Rational. To maintain independence and control of the patient. 3. Instruct the patient to discuss personal feelings with the supporters of such clergy if desired. Rational. Facilitating the process of grieving and spiritual care. Complications. Complications of gastric carcinoma include malnutrition, malabsorption, bowel obstruction, gastrointestinal bleeding, chemotherapy side effects, anorexia, bone marrow damage, constipation and diarrhea, hair loss, increased risk of infection, mouth sores, nausea and vomiting, weakness or fatigue, post-operation complications, wound infection, leaking from where the stomach has been closed or reattached, stricture, chest infection, internal bleeding, blockage of the small intestines, acid reflux, vitamin deficiency particularly with B12C and D, anemia due to deficiency of WIC B12, brittle bones and weakened muscles due to WIC D deficiency, infection, weight loss. Eating even a small meal makes them uncomfortably full.